New CDC guidelines say any American who suspects they have coronavirus can be tested for the potentially deadly disease. All you need is approval from a doctor. This comes amid growing criticism that a delay in testing may have compromised the nation's ability to detect cases and prevent the spread of the virus. Our Dr. Tara Narula is here. Tara, what's the problem exactly?
Well, Anthony, the FDA says there are only 15,000 coronavirus test kits available. Because of that, it's authorized commercial labs to develop more tests. By week's end, the CDC expects state health departments to have enough test kits to test 1 million people. The delay in CDC test kits isn't stopping some states from unveiling their own testing procedures. Public health experts say it's all hands on deck.
We cannot have a system which is centralized in a few laboratories. Really, the frontline battle of the response to the new coronavirus will be done in the outpatient clinics in the hospitals.
Private hospitals like NYU Langone are also making plans.
I think the CDC was under-testing.
Dr. Jennifer Leiter manages infection control and expects the medical center's own coronavirus test will be ready in about a month.
To really establish a new test needs a certain amount of validation and time.
Across the East River at Northwell Health's LIJ Forest Hills Hospital, healthcare workers are preparing for a potential surge of coronavirus patients. The hospital sits between two of New York City's international airports. Officials here are concerned this could become an epicenter for coronavirus, but say they are prepared.
What we're doing right now is we're trying to screen for anybody that would be at a high risk.
Dr. Teresa Amato is the director of emergency medicine.
It's really important to be over-screening in some sense. We'd rather isolate more patients than less.
There have been no suspected coronavirus cases here, but if a patient has concerning symptoms, the patient is immediately given a mask and is isolated. This is where a patient would come if there was suspicion for coronavirus.
Correct.
And what's the difference between a negative pressure room and a regular room?
So our regular rooms just have regular air circulation. So here we actually have, the air is actually pulled out of the room and through a filter.
The emergency room at LIJ Forest Hills has on average 60 beds. Coronavirus fears are fueling concerns rooms could be easily overwhelmed.
They're already looking at how could we either open up something outside and put up a tent? Could we, use a larger building that's not being utilized right now?
It sounds like the message that you're sending is not to panic.
I don't want to, completely sugarcoat it that we're, don't worry at all. But I think at the end of the day, this is what we do. We're going to be cautious in the sense that we're going to keep preparing, but I don't think anybody should be panicking.
Patients with mild symptoms will be sent home with a face mask and be asked to self-quarantine at their home to limit the spread of the virus. And full disclosure, I am affiliated with Northwell Health.
What about the people who don't really think they have the virus, but just for their own peace of mind, they want to be tested?
Are you referring to someone at this table, Gayle? I know who you're talking about.
Gayle would like a checkup while you're here.
I said, because I do think there are a lot of people like myself who don't think they have anything, but they just for their own peace of mind. That will create problems for people who legitimately need the test, right?
Absolutely. And so now this change that's really opened it up to say, anyone can get tested with a doctor's order is potentially going to cause an influx of people like yourself, Gayle.
Yes.
One outstanding question is who's going to pay for all this, particularly when you got 28 million Americans who don't have any health insurance at all.
Right. One other interesting thing I wanted to mention that the hospital told us they're doing yesterday to prepare is practicing drills. And one of the drills they're doing is to have secret shopper patients who come in, say they have a fever, cough, they've come from a concerning point of origin internationally, and then they watch how the staff reacts. Do they gown appropriately? Do they do everything right? And then they critique them. And they also critique from the patient side. How did you feel as a patient? How were you handled?
And we keep hearing that masks don't do any good, but all the healthcare workers are wearing them.
Well, the healthcare workers are wearing to prevent inhalation, but
they're exposed.
Right. And so if you're sick, it's helpful as a patient to prevent the spread of the droplets. But for everyone else, unless you're really using those N95 respirators that the healthcare workers are working, it's not going to be.
All right. Thank you, Tara.